What if what you thought was supposed to be the time of your life, well, isn't? Having a baby is both an exciting and a challenging time. However, sometimes it can be a bit more challenging than what you expected. It is not uncommon for mothers to experience the baby blues in the first few days after birth. The baby blues symptoms of teariness, anxiety, or irritability usually resolve within a few days. However, sometimes these feelings can go on for an extended period of time. If this is the case, you may be experiencing postnatal depression. Postnatal depression is a feeling of depressed mood lasting more than 2 weeks, beginning within 4 weeks after birth. Common symptoms include feeling sad, hopeless, overwhelmed, exhausted, worthless, and guilty. Some mothers may even wish not to be alive. However, if you are feeling this way, it's important to know that you are not alone. In fact, around 1 in every 7 mothers experience depression in the first year after birth. Because of this, it is really important to discuss what causes postnatal depression, what contributes to prolonging the condition, and what plays a role in the recovery process. There are multiple factors thought to contribute to someone developing postnatal depression, some biological, some psychological, and some social and cultural. From a biological perspective, specific genes have been found to be associated with postnatal depression. This means that if you are born with certain genes, you may be at greater risk of experiencing depression after giving birth. So remember, if you are feeling this way, try not to blame yourself. It is not your fault. Research has also found that having low levels in a number of neurotransmitters in the brain are a factor in many mothers experiencing postnatal depression. These chemical neurotransmitters are serotonin, dopamine, and noradrenaline. We also know that hormones play a role in the development of postnatal depression. After delivery, levels of the hormones estrogen, progesterone, and cortisol fall significantly. These hormones influence our mood. Some women are more sensitive to this change in the levels of hormones, which means they are more at risk of experiencing low mood. Psychologically, adapting to parenthood can be really daunting. A new mum has to contend with the constant demands of her baby, a different dynamic in the relationship with her partner, and a loss of her own independence. On top of all of this, there is the physical recovery from childbirth and coping with broken sleep. It can be a lot to take in. Sometimes when people are feeling low, certain patterns of thinking become more common, such as focusing on negative thoughts. These thought patterns have been associated with the development of postnatal depression. Some of these common ways of thinking may be focusing on the thought that others are judging you on your ability to be a good mum, or feeling inadequate, especially when it comes to breastfeeding and the pressures that can be placed on women with feeding. Recovering from childbirth, as well as caring for your newborn and trying to keep up with home responsibilities, can be really taxing. The sleeplessness, fatigue, or exhaustion you might be experiencing can increase your vulnerability in developing postnatal depression. From a social perspective, there are many factors that may contribute in the development of postnatal depression. These include stress or conflict in relationship with a partner, a perceived lack of social support from family and friends, and other life stresses, such as financial stress that comes with having a baby. It is important to understand that postnatal depression is not caused by just one thing, but more likely a combination of all these factors interacting together. Every mum is different, and so is every baby. Many mothers who are experiencing postnatal depression feel like it's just never going to end. It can feel like it will just go on forever. While most mothers, postnatal depression will resolve in 3 to 12 months, there are numerous factors that can prolong the condition. Not addressing the factors that cause postnatal depression is likely to prolong the illness. If neurotransmitter deficiencies are in part contributing to the mother experiencing low mood and are not addressed through medication, they will continue to maintain the low mood. Additionally, the changes in hormones mentioned earlier are an ongoing thing. The changes in hormones experienced throughout pregnancy can take up to 1 year to stabilise and return to normal levels. As such, these hormones play a role in prolonging postnatal depression. From a psychological perspective, women with postnatal depression may find their thoughts centre around negative evaluations of themselves, feeling inadequate, or may feel guilt or like they are failing as a mother. This cycle of thinking makes it really hard to break out of the depressive cycle. That feeling of low mood can really make it hard to go out and be sociable. But staying at home and avoiding social interactions where you might see your friends and family can make it harder to break the cycle of depression. Sometimes we even avoid pleasurable activities just because we don't feel up to it or we think we might dampen the mood. This again may contribute to prolonging the low mood that you may be experiencing. Despite these factors that maintain postnatal depression, it's really important to know that recovery is possible and it is expected. A key part of recovery is visiting your GP. In some cases, where the depression is seriously affecting mum and baby, a stay in a mother and baby unit at a hospital may be recommended to help support you as you start on your road to recovery. To address the low levels of neurotransmitters that may contribute to postnatal depression, your GP may also discuss with you taking some antidepressant medication. Unfortunately, there is no medication the GP can recommend to help hasten the process of your hormones stabilising. But the GP can hopefully bring you some comfort in assuring you that they typically will return to normal levels within a few months. From a psychological perspective, another part of the recovery journey that might be useful is engaging in individual or group psychotherapy. Recognising and understanding how your thoughts, feelings and behaviours interact has been shown to help in a mum's personal recovery of postnatal depression, as well as improving long-term outcomes for the baby. Being well rested is a key component in recovering from postnatal depression. Getting enough sleep can have carry-on effects in other areas of your life, including having greater motivation and energy to exercise, which is also a great way to help in your recovery. While being tired is a common occurrence when becoming a mum, if you feel like you need additional external support, there are options, such as infant sleep intervention schools. Other strategies include engaging your partner, family, and friends in providing you with both practical and emotional support. There are even peer support treatment programs available if you feel like you just don't have enough support around you. Interacting with people outside the home is also a great way to re-engage socially and help your recovery. You could even start with simply calling a friend. So now you can see postnatal depression is complex, with biological, psychological and social factors contributing to the onset of the condition, the maintenance of symptoms and the recovery process. So, what if what you thought was supposed to be the best time of your life, well, simply isn't? What if it's a bit more challenging than exciting? What if those baby blues are just not seeming to go away? We want you to know that you are not alone, that help is available. And although it may not seem like it right now, with every step you take in the right direction, a little light will begin to shine through onto your situation. If you're wanting to find out more about postnatal depression, you can simply search these sites, call the Panda hotline, or organise an appointment with your general practitioner today.